So we often hear from seniors that they're really concerned about how their Medicare benefits are going to change under the Affordable Care Act. And it's really important for seniors to know that their benefits are not going to change. If anything, they're going to improve. There are behind-the-scene changes in quality and efficiency that will make Medicare coverage even better under health reform. So health reform has several major changes to the Medicare program. There are both additional benefits for recipients of Medicare, and there are also some cost savings provisions that are involved in health reform. So first, let's talk about the extra benefits that are provided to Medicare beneficiaries. There is about $100 billion in new spending to increase benefits to make the Medicare program more effective for seniors. These new benefits include things like no cost sharing for preventative services. So when you go to the doctor, you don't have to pay a copay to see that doctor for preventative care, such as immunizations, flu shots, that type of thing. Also, as a senior, you can get an annual health risk assessment, which is a chance for you to sit down with your primary care provider and talk back and forth and come up with what are your health risks and how can you stay healthy. What this results in is an annual health prevention plan. So what are the ways that you as an individual can stay healthy and prevent chronic diseases from happening? Other benefits included in health reform include closing the Part D donut hole. What is Part D? Part D is the prescription drug benefit within the Medicare program. Currently, Medicare recipients, and about 2 to 3 million Medicare recipients, reach this donut hole. And the donut hole is really when a Medicare recipient has to cover the full cost of their prescription drugs all on their own, and they don't get any assistance from the insurance company in paying for those prescription drugs. So what health reform does is close that donut hole. And so all Medicare recipients in Part D will be responsible for about 25% of their Medicare prescription drug costs, and the insurance plans in Part D will cover the remaining 75%. As the baby boomers retire, we will need a larger number of primary care physicians. So part of health reform is increasing the payment rate for those primary care doctors to encourage more of them to take Medicare recipients. So another area where there is savings to the Medicare program is in the area of Medicare Advantage. The Medicare Advantage program is Medicare through private insurance companies. And what happened was in the 1990s, private insurance companies came to Congress and said, we can provide Medicare coverage to seniors and we can do it at a more affordable rate. And what happened was they didn't. So currently Medicare Advantage plans are paid on average 14% more than what it would cost to have a senior, someone on Medicare in the traditional Medicare program. So what the Affordable Care Act does is cut those payments to private insurance companies for Medicare Advantage down to the exact same level as Medicare fee-for-service, the traditional Medicare program. Another area where there is savings within the Medicare program is payments to hospitals and providers that are based on quality. So if we increase the quality of care that hospitals and physicians are providing to our Medicare recipients, it actually makes for more efficient care, which will actually produce savings to the system. So ultimately, it's really important for seniors and for those that have Medicare to understand how the health reform law impacts them, both the new benefits that they will receive under the Affordable Care Act and also the changes that will produce savings within the Medicare program.